I'm Kathleen Connell, the Senior State Director of AARP Rhode Island. AARP just assigned the titles Senior State Directors in the past year. Before that, I was just a nice middle-aged state director, but I guess I crossed the line. We are all now called Senior State Directors, so we're not always happy with these, and it didn't have any extra pay with it either. But anyhow, we are just so pleased today to be here with all of you and with the cooperation of the Rhode Island State Nurses Association to take what we hope will be a more in-depth look from different perspectives at the topic that has dominated the news so much all summer. You've all seen television about the town halls and listened to millions of people on the radio talking about various aspects, but we thought we needed some other perspectives to shine on the issues, and that's what today's forum is really all about. I'd like to recognize a few people before we begin. We have the AARP Rhode Island Executive Council members here, and I would just ask you if you raise your hand. State President Dr. Tony Regine, Ruth Thompson Bodge, excuse me, Alan Neville, Ann Gardella, and Donna Policastro. Ann and Donna are both going to be on your panel. We wear lots of hats in this organization, and Donna is the Executive Director of the State Nurses Association, and Ann is one of our longtime volunteers. More about her later. Anyway, we are trying to make this as interactive and frankly as congenial as possible so that we can have a real conversation about this topic that is of such vital importance to every American. And the way we are going to do it is, in a minute or two, I will ask the panel to come up and take these chairs. Each panelist will come up and talk to you to give their immediate perspective, and after that, we will open to questions from the floor. And you have cards on your tables and pens. If you would write your questions and raise your hand, we'll pick them up. We will, however, give opportunity as it presents for people to not have the question on the card if that doesn't work for you. In other words, if you suddenly feel that something was said that you really must ask a question about, put your hand up as we get into the dialogue. We're going to have two people on the mics, my daughter Kathleen and Deborah Miller from our staff. You may have seen Barbara Peters, our Director of Communications, running around running the show. And we have a number of our dedicated volunteers here to both listen and to assist as needed. With that, if you panelists have finished your coffee, I would ask you to come up and take the panel seats. And Congressman, if you would join us, please. There's not a real order, per se. So, in order to give you these perspectives that we think are so important, and many of which we think have not been touched on sufficiently as the debates raged all summer, we have the doctor, the nurse, the consumer, and the lawmaker. And so, we may not have all the answers, but we ought to at least get to the questions and the perspectives that we need to share. Starting at the far end, we have Dr. Nick Chungus, Congressman Patrick Kennedy, AARP Rep. Ann Gardella, and Donna Policastro, and I will introduce them as they present. I would like now to call upon our state president, Dr. Anthony Regine, to introduce our special guest. Dr. Regine was named volunteer state president of AARP Rhode Island in 2007. He was chosen from a select pool of volunteers to head the nonprofit, nonpartisan organization in Rhode Island. After many years as a board member of Advent House, the oldest shelter in Rhode Island to serve substance abuse populations, he served 3 years as president of the board. He has also served as a member of the boards of the Rhode Island Heart Association, the American Red Cross, Opera Providence, Japan American Society of Rhode Island, Volunteers in Cranston Schools, and the Autism Project. Before his retirement, he maintained a private dental practice on Reservoir Avenue in Cranston. He has participated in the Volunteer Dental Service Program for low-income clients. A graduate of Tufts University, the Baltimore College of Dental Surgery, and the University of Maryland Dental School, Dr. Regine is a member of the American Dental Association, Rhode Island Dental Society, and Cranston Dental Society. It's a pleasure to introduce our state president, Dr. Regine.
Thank you, Kathleen, for the opportunity to be here today as we attempt to bring some light on the subject of healthcare reform. I am anxious to hear from all of our speakers today, and I am especially happy to have as our special guest United States Congressman Patrick Kennedy. Patrick J. Kennedy was re-elected to serve an 8th term in Congress in November 2008 as a representative from the 1st District of Rhode Island. A member of the influential House Appropriations Committee, Kennedy sits on its subcommittees on labor, health and human services, education, commerce, justice, science, and related agencies. He is also a member of the House Committee on Oversight and Government Reform. A leader on healthcare issues, Kennedy was one of 31 members of the House of Representatives invited to attend the White House Health Reform Summit in March to engage in dialogue with a broad coalition of stakeholders in healthcare reform. As a founding co-chair of the House 21st Century Healthcare Caucus, Kennedy has been a vocal proponent of healthcare reform, calling for a shift from the current sick care system to one which is patient-centered, collaborative, and focused on prevention. Kennedy is a nationally respected voice on mental health issues, fighting to end discrimination in health coverage. Working with Congressman Jim Ramstad, he successfully led the fight to pass the Mental Health Parity and Addiction Equity Act of 2008. The new law prohibits health insurers from placing discriminatory restrictions on mental health and addiction treatments. By eliminating the disparities between mental health and other medical benefits, more than 113 million Americans can finally receive the treatment they so desperately need. It gives me great pleasure to present Congressman Patrick Kennedy.
Thank you very much. I want to say to begin with that I am very honored to be here with all of you this morning, and I had a chance the other day to, in a totally Rhode Island fashion, be with Mr. Regine's granddaughter in Washington, D.C., and she said, "You'll see my grandfather this weekend." So it was typical Rhode Island for you, and didn't know at the time that you'd actually be introducing me, but that's perfect. And it's always great to see you at all these events, and thank you for that nice introduction. And Kathleen, thank you for your leadership. They can call you senior, but it's only a state of mind, and you're always out there active and running this organization like a true active person that you've always been. And I really appreciate the great work that you've done with AARP here in the state, as everybody who has been part of AARP in today's event, helping to pull it together. Thank you for doing